everyone, I'm Casey and I'm here today with Dr. Lee, and we are going to talk about some of the most common signs your pet may be ill. So Dr. Lee, what are some of the most common reasons that clients come to see you, and what are some of those most common signs?
Well, one of the most common reasons people bring in their animals, we call it ADR, meaning ain't doing right. They just have a feeling that there's something not quite right about their pet. He's just not playing with his toys the way he used to. He's just not quite as affectionate. He's sleeping in. He might be having trouble going up and down the stairs. So there's sort of a whole plethora of reasons where a client can't put their finger on it. And it's often something that's been going on for days to weeks. So that might be the number one reason we see animals.
Okay.
Now there's some real obvious clinical signs or symptoms that we ask clients to look for, especially as pets age, because just like us, major organs can become involved, and we see in people, we see diabetes in dogs and cats, we see kidney disease in dogs and cats just like we do in people. Cardinal sign: drinking too much, urinating too much. So water consumption is something that's very, very important to watch, and urine output. And speaking of urine, if an animal has a hard time urinating, that could indicate a problem in the urinary tract itself, either bladder stones, kidney stones, or especially in female dogs, urinary tract infection.
Okay.
So they're trying, they're squatting, they're straining. So, drinking too much, having a hard time urinating are signs of could be fairly serious disease. Another thing is to keep an eye on your dog's weight, okay? Weight gain in a dog, for example, could indicate something like hypothyroidism, an underactive thyroid gland. Weight loss in a cat could indicate an overactive thyroid hormone production. We call that hyperthyroidism. So weight, just like people, constant, steady weight that's not changing is usually a pretty good predictor of good health.
Okay.
We don't want to see drastic weight changes either way, okay, because that could indicate, pretty significant disease.
Right.
Appetite is another one. Okay, we want the appetite to be consistent. Now, some dogs are chow hounds, they'll eat everything, but those chow hounds, if they suddenly are not interested in their food, that's not something you want to ignore.
Right.
So appetite needs to be consistent. Same with cats. Okay, I mentioned hyperthyroidism, also diabetes. We know with people, when people are diabetic, they tend to have a ravenous appetite. Their body is not processing things properly, and they need to eat more to compensate for the diabetic state. Same thing in our furry friends, okay?
Yep.
So increases in appetite combined with weight loss can be an indicator of really serious disease. So those are probably the really big things. So obviously throwing up, diarrhea. We want to see nice form stool, and activity level as well. We want them to be bright, alert, and responsive, interacting with us like they normally do on a daily basis, taking into consideration as a dog ages, they're not going to be just like me, they're a little, less active than they were when they were in their 20s, for example, but, certainly if you see them having a lot of trouble getting up, going up and downstairs, those are all reasons to bring them to your veterinarian sooner than later.
Awesome. Those are great tips. So really it's diarrhea, vomiting, change in appetite, change in urination, change in thirst,
exactly,
and change in behavior.
Absolutely.
Those are things that would trigger, concerns.
Absolutely.
Fantastic.
Consistency is the rule.
Excellent.
We want to see nice, consistent
Excellent.
clinical signs.
Fantastic. Well, thanks so much,
Thank
Dr.
you very
Lee.
much, Casey.